medical supply chains are degraded through harvesting and extraction processes, affecting biodiversity. Toxins released throughout the life cycle of medical supplies lead to acute and chronic health effects among patients, workers, and nearby communities. Pharmaceuticals that enter the environment through manufacturing, excretion, and disposal pollute aquatic ecosystems and contaminate drinking water. Carbon emissions from the factories, trucks, and cargo ships that produce and transport medical materials contribute to the destabilization of the global climate. Each of these challenges represents an unintended consequence of healthcare, and each is driven by clinical practices and medical decision-making. These negative outcomes of medical care raise both the ethical dilemma that to improve the health of patients, we may unintentionally harm the health of the workers and communities on which the healthcare system depends, and the irony that healthcare contributes to ecosystem degradation, biodiversity loss, and climate instability, which negatively affect human health on a global scale. One of the clearest examples of the challenge that medical care poses to environmental sustainability is its impact on climate change. In September 2021, over 200 international health journals concurrently published an editorial calling for action to reduce greenhouse gas emissions and calling climate change the greatest public health threat of our time. Recent estimates show that globally, the healthcare sector accounts for up to 5% of greenhouse gas emissions. In the United States, this statistic rises to between 8.5 and 10%, the highest of all industrialized nations. If the U.S. healthcare sector were itself a country, it would rank 13th for global greenhouse gas emissions. These emissions contribute to the destabilization of Earth's climate, which in turn affects human health in myriad ways. The National Climate and Health Assessment indicates 7 primary health impacts of climate change. These include temperature-related illness and mortality, respiratory and allergenic effects related to air quality, injury and death from extreme events, acute and chronic health effects of vector-borne disease, illness resulting from poor water quality, risks posed by food insecurity, and the cumulative burden climate change poses to mental health and well-being. The healthcare sector's contributions to the burden of climate-related illness result from the vast energy demands of the infrastructure needed to provide patient care. Some might argue that these externalities of healthcare are unfortunate but necessary in order to promote the health of our citizens. However, despite having the most expensive healthcare system in the world, the United States lags far behind other countries in several health outcomes. In 2018, the United States allocated nearly 17% of gross domestic product to healthcare, representing over $10,000 per capita on healthcare spending. As such, the United States held the top rank of all countries for healthcare expenditures, with nearly double the average expense of the 36 high-income member countries of the Organization for Economic Cooperation and Development, OECD. Despite the amount of money we allocate to healthcare, Americans have the highest rate of obesity, the highest rate of hospitalization and premature death from preventable diseases, and the highest disease burden among adults when compared to our peer countries. Perhaps most tellingly, despite our higher healthcare expenditures, Americans have the shortest life expectancy at birth. We spend 31% more on healthcare per capita in the United States than Switzerland, yet the Swiss live on average 4 years longer than America.